Do you need the light on?
What?
Do you need the light or
No. It makes a weird glare. Hello, and welcome to my YouTube Live. Today we're going to talk about everything about going through the change from perimenopause to postmenopause. Some of you have sent some questions ahead, so I'll go over those to start with. But I just want you to understand that going through the change is a transformation, not just a physical transformation with your hormones changing and your skin changing, your hair changing, your strength changing, maybe body fat changing somewhat, but it's also a spiritual transformation. It's a time when your mindset can shift and you can actually have some healing that maybe you weren't able to experience when you were younger. It's a time where you can start to slow down. Once you get through the roller coaster, you can start to slow down and really be present in the now moment and kind of tap into the wisdom that you've collected over the years through your experience. Most women going through menopause have had a lifetime of experience, careers, relationships, maybe children, maybe they're sandwiched right now, taking care of elders and also taking care of young children or teenagers. But they have a lot of wisdom in them. And unfortunately, we're not able to kind of tap into that in the midst of all of the drama we're going through with our hormones all over the place and not sleeping and having hot flashes and just being moody and we can't think properly and maybe our joints are achy. We're having all of these different symptoms. It's hard to tap into some of that wisdom, but I will tell you, being postmenopausal and having passed all through that it definitely gets better and you are able to tap into that and share those pieces of wisdom. And it's like you don't have to worry about 20/20 hindsight anymore. You start to get the messages in the moment, which is great because you learn a lot quicker that way. And you're able to live in a more joyful, more peaceful place. So let's answer some questions here. And when you guys get in here live, I'll answer even more. So this one person is saying that she needs help with her hormones and she's thinking about starting testosterone, but wondering if she should take GenPro. She's very confused. She's already taken Genesis Gold and Sacred 7. Her symptoms have been increasing and she's not sleeping. I would start with GenPro and not testosterone. I always start my patients on estrogen and progesterone way before testosterone. I have very few of my female patients that use testosterone as part of their replacement therapy, because what I find is if they have adequate amount of progesterone and adequate amount of estrogen, that usually takes care of the majority of the symptoms, including the sexual symptoms. So the majority of my patients who do take testosterone, it's usually because they have severe osteoporosis and we're trying to build up their bones. So once you get into the postmenopausal state, you actually make more testosterone naturally because your theca cells are still putting that out, but you don't have as much estrogen available. So it's hard. It is possible to become testosterone deficient in menopause, but it is not the first hormone to start with. It really is down the line. So start with GenPro. And if you are menopausal, you're going to take about 50 milligrams, which is 2 pumps twice a day, all through the month. Maybe take 3 days off per month. That should help you sleep. That should help quell some of the symptoms if the hypothalamus is not feeling like it's, getting all the information that it needs from the Sacred 7 and the Genesis Gold. That will help to start with. You may need some estrogen as well. So here's another question. This person says she's 60 years young. She started menopause at 55, which is great. When you have that later menopause, that just means you have more hormones on board and you can be a little more youthful, a little longer. She weighs 128 pounds and she can't seem to lose the 15 pounds this new chapter has brought. She does not tell me her height. So let's talk about weight before we start talking about the rest of what's going on with her. So when you're menopausal, it is not unusual for you to put on some weight during perimenopause and into menopause. But I have a real concern with smaller, thinner women losing too much weight in menopause and postmenopause. This woman is postmenopause since she's started menopause 5 years before. We don't want her to lose lean body mass, muscle or bone. So you have to continue to exercise. I don't go by pounds and weight. I go by inches. How thick is your waist? How thick is your abdomen? Do you have back fat? What's going on with the extra padding that you're putting on? That is what you're going to try to lose. Your pounds may not change that much. Your weight may not change that much. And the reason for that is if you're exercising, especially doing weight resistance exercising, and you're building up muscle and bone and you're losing fat, muscle and bone weighs so much more than fat. So I really would want to know more, not what your weight is and how much weight you want to lose. Don't hold on to that number on the scale, but really, what is your lean body mass and how much body fat do you have? And is that within a healthy range for your age, your height, your ethnicity? So she's been taking Genesis Gold and a couple pumps of the Gen Pro. Got her blood work back, said estrogen and progesterone were a little low. So because she's postmenopausal, I would say 2 pumps twice a day for her. So I'm not surprised that would be a little bit low. She thought she might try some phytoestrogen and as well. So I would definitely take some extra progesterone at night. So she takes 2 pumps of the Gen Pro in the morning and 2 pumps at night. That'll bring her hormone levels up. And lifting weights to raise her muscle mass and also increase testosterone, that's great. So when your estrogen levels are low and progesterone levels are low, you're metabolically less active. So as those numbers start to come up, you become more metabolically active. So you're able to build more muscle, more lean body mass, and decrease that body fat. My favorite calculator is the Navy calculator. You can see it online. It requires a neck measurement, a waist measurement, a hip measurement. It wants your height and your weight. And if you put those measurements in, it calculates pretty close to what your body fat percentage is and pounds of lean body mass is. That's what I want you to look at. Okay. So it's not as accurate as it needs to be for someone who's super athletic, but for the average person, it's pretty accurate. I also would consider if she's having some issues with sleeping, adding a little extra testosterone. Not testosterone, Sacred 7 could be super helpful to help her to sleep a little bit better. And then to make a little more testosterone during perimenopause, menopause, and into postmenopause, checking those DHEA levels and maybe adding DHEA sublingually underneath the tongue can be very helpful to naturally raise those testosterone levels if your DHEA levels are low. And DHEA can help to convert over to estrogen as well. Question number 3. Can you use Gen Pro if you're in postmenopause, and do you still need it? Yes, actually, you can use progesterone postmenopausally. Do you still need it? My belief is that you need your female hormones for, almost the rest of your life. It's really a personalized medicine, really looks at you as an individual, your risk factors, and basically your biological versus your chronological age. So Gen Pro is a safe hormone to use in postmenopause. It can help support your adrenal glands. It will help to support your bones. It will help to support your metabolism. So I would definitely look at Gen Pro as an option in postmenopause. 2 pumps once or twice a day should be enough to actually sustain you. Question number 4. This person's been on Genesis Gold for 30 days. Sometimes she still gets a little moody. She wants to know if there's anything else I recommend. So starting on Genesis Gold just for 30 days, you might not have been on it long enough, but usually if you're finding you're having irritability, moodiness, or any memory issues, depression, anxiety, anything like that, adding some extra Sacred 7 on top of the Genesis Gold can really help build up those neurotransmitters to help calm your moods, help your memory, help your cognition, and really help with depression and anxiety. It can also help you sleep. Here's another question from a 77-year-old woman who has menopausal symptoms. Yes, you can have hypothalamic dysfunction even as old as 77. I kind of call it like the second menopause. So when you go through menopause, let's say in your 50s, and you have all the symptoms, the hot flashes, the night sweats, you're having achiness, irritability, maybe you took some hormones and it calmed down. Maybe you didn't. And eventually your hypothalamus just kind of got used to everything. But part of what's going on is your adrenal glands have been producing some of your sex steroids, converting from DHEA, some of those sex steroids that your body needs, kind of keeping you at bay. But 10, 15, 20 years later, your adrenal glands are pooped. You're just not producing the same amount of DHEA as you used to. So you're not converting it into testosterone and then into estrogen. And so you can have a recurrence of menopausal symptoms, almost like a second menopause. So I would want to really check those DHEA sulfated levels and see if you're low. And some sublingual DHEA and some Gen Pro may be the best thing to control those symptoms. Of course, supporting your hypothalamus with Genesis Gold and Sacred 7 can really help to balance out that hypothalamic dysfunction. Okay, so here's another question. This person is also considering the progesterone cream. She had trouble tolerating progesterone in HRT. Even 50 to 100 grams tends to make her feel depressed and way too tired. Now, my question is, and I don't know this from this question, is whether she was taking oral progesterone or transdermal. Oral progesterone, even micronized progesterone, natural progesterone in a capsule, usually in an oil, is converted into a form of progesterone that actually is very sedating. So it only should be taken at night. The transdermal progesterone does not have that same sedative effect. So when you're using it transdermally and you're bypassing that first bypass of the liver, you're going to have much less fatigue effect with progesterone. You shouldn't have it at all. It can calm your moods and help you to produce GABA, which if you're anxious, that will help, but it will definitely calm things down. So she was wondering about the progesterone cream because she was having issues with wild yam. All progesterone, natural progesterone, whether it's the prescription version, any of the creams you find out there, are going to have been derived from yam, from a wild yam. Okay, it's different having USP grade progesterone in the cream versus a wild yam cream. So cream that just has wild yam in it, your body's not going to be able to convert it into progesterone as effectively as having just the progesterone in the cream, but they all then come from the wild yam. That's where we derive them from. Just like we get most estrogen products from soybean, if they're plant derived, that's where we're able to create estrogen from that. So let me see what else she's asking here. She's taking some desiccated thyroid supplement as well. And asking about thyroid supplementations. I don't have I don't produce a thyroid supplement, but what I do find is that when you're taking Genesis Gold with the full grains in there, it makes a big difference in supporting normal thyroid function. So I would definitely make sure you're taking enough Genesis Gold and adding the Gen Pro, and that would definitely help your symptoms. Now, Natalie's on here. She's taking Genesis Gold every morning, as I recommended in my video. She's also taking some vitamin E, fish oil, iodine, and a vitamin for women 50 plus at the end of breakfast. Should she take all this, continue to take all this? So what I recommend is when you first start Genesis Gold, take everything you're already taking. And then 30 to 60 days into your Genesis Gold journey, you can stop taking some of that supplementation. I would start with taking away one thing at a time. So I don't know what your age is. I'm assuming you're 50 plus. I would keep the fish oil. You won't need the extra iodine because of the seaweed. You may not need the extra vitamins. Okay. Right now at 64, I don't take any extra vitamins. I only take my Genesis Gold. I do occasionally take some other supplementation if I have injuries, like I have some strain in my neck. So right now I'm taking omega-3 and curcumin. That helps with that inflammation. It'll be for a short period of time, probably 6 weeks or so. So I use it more like medicine. But in terms of the vitamins, I don't take anything else. Now, I recently went, because of my neck issues, I went to my primary care provider, who's very young. It could be my child. Anyhow, he used AI to kind of figure out what was going on with me and thought, well, maybe you have neuropathy. And I explained to him, I'm pretty sure I have a pinched nerve in my neck. And because traction is helping and heat and red light is helping. But anyhow, so he ran all of these tests, including a huge panel of vitamin tests, all the B vitamins, a bunch of minerals. I mean, you name it, he ran it. All of that was perfectly healthy and normal. I take no extra vitamin supplementation. So that is Genesis Gold and a super healthy plant-based Mediterranean diet. That's what's keeping my levels fine. So vitamins were actually created for people who had a poor diet. So if you aren't able to eat a full spectrum diet, we actually add vitamins into your regimen so that you can actually have all the vitamins you need. If you're eating a full plant-based diet, a Mediterranean type diet, you're probably, and it's very colorful and you're getting all the different vegetables and fruits in it, you're probably getting enough vitamin supplementation. And there's quite a bit not added synthetically into Genesis Gold, but just within the plant foods in there, in those plant foods as well. But go slowly, weaning yourself off of the supplements to see what your body seems to still need. Okay. If you can't adapt your diet to a full spectrum plant-based diet where you're getting all those vitamins naturally, you may still be on the extra vitamin supplementation a little bit longer until you can do that, Natalie. Okay, so I have another question here from a perimenopausal woman had a partial hysterectomy. You're very welcome, Natalie. A partial hysterectomy at the age of 23. How does she figure out what her 15th day is? Obviously, she hasn't had a period. So if you've had a hysterectomy, you don't need to figure out your 15th day, okay? You still have your ovaries. You can use the calendar. You can use the moon cycles. I like the moon cycles. So if you can remember back when you were very young, maybe you can't, that, 20 years ago or so, when you actually were having your periods, were they on the full moon or on the new moon? Then you use the moon cycles as your basis. If you can't figure that out, we'll just plug it into the moon cycles, or we'll do 2 weeks on, 2 weeks off. Okay. So 2 weeks on taking GenPro and then take 2 weeks off. Once you go into menopause and you're no longer making enough estrogen because you've run out of eggs, you'll need to be taking the GenPro throughout the month, just taking 3 days off a month. So you can go by the calendar, 2 weeks on, 2 weeks off, or you can go by the moon cycle. Let's say the new moon acts like your period, so you start taking the GenPro at the half moon phase until the full moon. Whatever works for you. Most of my patients with hysterectomies use the calendar, and that works very well for them. Okay, here's another question. This is from a woman who watched my vaginal atrophy video and was wondering about how not to have anxiety when the vagina is very itchy and the doctor tells you the cream's going to fix it, but it's unaffordable. Plus the symptoms have lasted for about 20 years. Of course, you're going to be anxious. Okay. So one of the things with having itchiness, whether it's in your vagina or it's on your skin, is once you start that itch scratch cycle, it's hard to break it. So you can actually kind of train your nerves to be constantly itchy. So one of the things that will help with vaginal atrophy is estrogen. If you can't afford to use estrogen, it makes it a little bit harder. So you can use a couple different things. So one thing will help with the itchiness as well, and some of the dryness, which is usually what's causing the itchiness. And so the nerves are very, very exposed. And so they're getting irritated by everything, air, your underwear. Once you start scratching or touching yourself to try to relieve the itchiness, that irritates it. So using coconut oil as a moisturizer for the labia, the vulva, the vagina can be very helpful. Okay, so I would definitely start there with some coconut oil and see if that doesn't help calm down some of this vaginal itchiness and dryness. You may want to consider using some GenPro systemically because that can help. I know that my patients who've taken Genesis Gold for at least 60 to 90 days do notice that their vagina is much more lush when they're in their postmenopausal period than women who aren't taking it. It just takes some time to get the adrenals making enough DHEA to convert into estrogen to start to heal up that vagina. So I have somebody on here, Debbie. She wants to know if she had endometriosis postmenopausally, but she's not feeling well hormonally. So what if you had endometriosis and she's postmenopausal and not feeling well hormonally? Okay, so if you're truly postmenopausal, most of the time your endometriosis has calmed down, okay? I would start non-hormonally by supporting your hypothalamus nutraceutically with Genesis Gold. And if that's not enough, you can add GenPro, okay, which is the progesterone, and you could use that transdermally before considering estrogen. Okay, I've had my postmenopausal women with very active endometriosis in their reproductive years do very well on hormone replacement therapy, but the first thing I do is calm their hypothalamus down with Genesis Gold for at least 90 days before we start adding first the progesterone And if that's not enough, then the estrogen into their hormone regimen. We don't want to wake up some old endometriosis spots. They're basically like little satellites outside of the uterus. It could be anywhere on the bowel, on the bladder, on the ovaries. We don't want to wake them up. It's mostly an issue early in menopause where you're trying to give hormones and we're waking up some of those endometriosis satellites again. They finally went to sleep because you're menopausal and now they wake up again. But if you start with the Genesis Gold and maybe some extra Sacred 7 if you're having quite a bit of hot flashes and you're having trouble sleeping, if you're having some cognition issues, some memory issues, that will help you heal fastest and really help your body recover so that you don't have to add the hormones, but give you a period. And if you do add the hormones, you'll use very little doses so you won't wake up those endometriosis, we'll call them satellites. Okay, let me see. All right, so I have a question here from a male who's asking, in my video, tips for sex after menopause, is not able to have sex at all with his wife. Okay, he doesn't give me any more information than that. So let's talk about sex after menopause. One of the issues with sexual activity in menopause, the biggest issue is the vagina becomes very thin, very dry, and so intercourse becomes uncomfortable. So in order to get that vagina thickened up again enough to make enough lubrication so that intercourse is comfortable, usually using topical estrogen, vaginal estrogen, estriol is my preference, estradiol would be second, in the vagina for at least 6 to 8 weeks to rejuvenate the tissues, and then maybe once or twice a week for maintenance is what is recommended to really heal up the vagina. Even if you have estrogen-related cancers, vaginal estrogen has been proven to be safe, but talk with your provider. That would be the first step. The other thing is, when you've been postmenopausal long enough, you can start to lose that libido, that sex drive. Now, one of the reasons you've lost that libido is because you've lost your sex hormones. And it's estrogen that really keeps that libido up. Again, if you can't take hormones or not able to get hormones, taking Genesis Gold can really help to get the hypothalamus balanced enough that it's able to survive and help you thrive so sex gets back onto your planner. Okay, so you start thinking about it. I've had quite a few menopausal and postmenopausal women start taking Genesis Gold, and after 90 days, sometimes it takes a little longer, like 4 months, about 120 days, they really start to have a lot more sexual urges. They start having more sex dreams. They're thinking about sex more. Once your hypothalamus is no longer in survival mode, like I said, sex can be back on the table. Okay. But if your hypothalamus is not getting everything it needs and you're no longer producing enough of your own sex hormones, then sex is the last thing that your hypothalamus wants to instigate when it needs your heart to survive and your brain to survive and your kidneys to survive and your liver to survive. It's trying to heal everything else up. So if it gets what it needs, it can get back on the table and you start thinking about sex more. You start desiring sex more. You become more sexually arousable. But you got to get that vagina healthy. Okay, you can be thinking about it and not have a healthy vagina. It's still very thin. So you may need to use estrogen vaginally to really get the vagina lush again, to produce enough lubrication to make intercourse comfortable. All right. I have another question here. So this person is asking about if periods can restart after menopause from that video that I produced. She's not taking any hormone replacement therapy. She has an FSH of 141. She's definitely menopausal. That's very high. Anything over 30 is considered follicle stimulating hormone, or FSH is considered menopausal. She skipped period for 2 years, had no period for a year, and then bled 5 days, stopped, bled again, slightly heavier 3 weeks later. It's been 7 weeks and no bleeding. She's going in for a biopsy and a D&C in a couple weeks. Uterine lining was 4.8. That's really not that thick. She's also very thin, about 100 pounds and 5'4". She's never been pregnant. So if your uterine lining is atrophic, meaning it's too thin, it can bleed spontaneously. Kind of like how very, very old people, when their skin gets really thin and they barely bump themselves on something, they just start bleeding. They'll either get a horrible bruise or tissue actually cracks open and starts weeping and bleeding. Same thing happens to your uterus when the lining is very, very thin. It means you actually need some estrogen. So the DNC will actually, the biopsy will give the information about what's going on there, but 4.8 is not that wide of a diameter for the uterine lining to be. So, and I'm assuming that was 4.8 in millimeter size. So if it's just that millimeter size, fine. If it's 4.8 centimeter size, then we have a problem. Then there could be a fibroid in there or something else going on. So the DNC is definitely the way to go to find out what's actually going on in your uterus to make sure that there aren't precancerous cells. And so spontaneous bleeding after not bleeding for a while is always something to be wary of. You get an ultrasound first, and then you need to get an endometrial biopsy and possibly a DNC where they kind of scrape everything out and see if it's because you don't have enough hormones or you actually have some growth, some hyperplasia that needs to be knocked out with a dilation and curettage. Curettage is actually like scraping out that lining. All right, I think I got all those questions. And if we don't have any other questions, when we start advertising for these lives, if you have any questions and you're not sure if you're going to be able to make it on the live, all you need to do is once you get the email that I'm going live is reply to the email and send a question in. You, of course, anywhere else you ask questions, I have my assistant Gabby going around looking for questions that are related. Whether you're asking it under in my on my blog site, in the YouTube site, if you're asking in hormone support group or in menopause action plan site, anywhere. But one of the things that would be super helpful for you is to read my menopause action plan book. It really goes into depth about what each of your hormones, not just sex hormones, but thyroid, adrenal, pituitary hormones, how all your hormones are affected during menopause, and what you can do about it, whether you need to take hormone replacement therapy, are there natural equivalences that you could do instead? What can you do to actually support you through the change before you even start the change, all the way through postmenopause? And I have you take into consideration whether you have risk factors for cancer, osteoporosis, heart disease. We talk about all of that in the book. I also, at the end of the book, there's a little link there that you can go and download the actual blank menopause action plan where you go through the book and write out what your plan is according to what you learned in each chapter. So you really have a full plan to go to your healthcare provider and say, okay, I figured this out and this is what I need. Think of it as like a birth plan for pregnant women who want to say, hey, this is how I want to birth my baby. And they go in with this plan. That changed OB-GYN, that changed obstetrics, having birth plans. Having a menopause action plan will, I hope, will change the way we treat menopausal women. They'll be more educated. They'll understand what's happening in their body. They'll be able to make better, more informed decisions and actually partner with their healthcare provider to get the help that they need, especially if they do need some hormone replacement therapy that requires a prescription. So in the meantime, Gabby's put some links on here for the Menopause Action Plan book, as well as Genesis Gold, Sacred 7, and Gen Pro. Thank you so much and have a wonderful, wonderful day, and I'll see you hopefully in a couple weeks. Take care.